When I and hundreds of families began to develop the Birthing Better skills in the early 1970s, it was really important for us to understand how we fit in to the healthcare systems where we lived and how we could have the most positive birth if we didn't have a lot of control. When I gave birth in 1970, there was actually in the United States a very high societal expectation that all of us learn Lamaze classes. It was taught everywhere, and Bradley was taught as well, and fathers were just coming in. This lesson is all about the 2s and 3s. You'll see a handout about teamwork. There are a lot of dads who went into birth and didn't really know what to do. And after the birth, women were really angry with them. And that meant that if a man fumbled in the birth, the woman often felt they would fumble with the newborn and would push him away. And around 18 months, the woman would say, I'm sick of having to take care of 2 children. The reality is, if we're going to have anybody come into the birth with us, they should know how to help us. There's an excellent handout on the skills we developed around teen birth. It's excellent, absolutely a must to read. The 3 births. We have a handout on taking the exact same birth, one that the woman felt good about and the man felt good about, one that the woman didn't feel good about, the man didn't feel good about, and then we overlaid the Birthing Better skills into that exact same birth. So that handout is also important. The 2 birth plan ones is really essentially important. Choices are variable. Sometimes choices work, sometimes you don't have any, sometimes you can't have the ones you want, and sometimes the one you want change. But skills are enduring. You can always use your skills. So you need to create a skills-based birth plan. And you need to tell your care provider from 24 weeks at every appointment, 24, 28, 32 weeks, and so on, what skill you learned that month, and have them put them in the notes. Whoever is with you can see that you have learned skills, and they can encourage you to use them if you look stressed or overwhelmed, or praise you if you are using them. The other handout is about birthing behaviors. We learned very early on that there are positive and negative birthing behaviors. The more we can stay in the list of positive birthing behaviors, and often that's because we have skills and so we intentionally use those, the better we feel about the birth afterwards. The other is the 3 birth roles. The woman is always birthing, and she is birthing alone, even in a room full of people. Whoever is with her, her partner or other, is there to help her cope, to manage, to work through, to handle, to deal with, to stay on top of, and feel in control of the internal and external factors impacting the birth as it unfolds. And the job of the birth professional is to do the assessments, the monitoring, and the procedures to safeguard the well-being of the mother and the baby. So pick and choose what you want to read, but become skilled with these as a foundation of your reasons why.